Hello viewers, welcome to our channel. In this video, we'll cover the basics of erectile dysfunction. What is it? Who gets it? The symptoms, diagnosis, and the treatments. Whether you're looking for answers for yourself or for someone you love, we're here to give you the best information available for your awareness. Erectile dysfunction, also known as impotence, is described as difficulty getting and keeping an erection during intercourse. It can be an embarrassing thing or situation to talk about. It's been reported that more than half of men between the ages of 40 and 70 experience some form of erectile dysfunction, so take comfort in knowing that you are not alone. Experiencing difficulty with erections from time to time is usually no cause for concern, but ongoing issues can cause stress. It can affect self-confidence, socializing, and it can contribute to relationship and affection for opposite-sex problems. Sometimes it may indicate an underlying condition. The bottom line is that if you experience ED, you should talk about it with your doctor or spouse, even if you're embarrassed or ashamed, because there is a number of ways that it can effectively be treated. Erectile dysfunction can be caused by physical or psychological issues. Sexual arousal is a complicated process. It involves your brain, your hormones, your nerves, your muscles, and your blood vessels. A hiccup in any of these can cause a problem during the erectile process. The fact is that erectile dysfunction affects men of all ages. However, as you get older, your risk can increase. This is not only because erections take longer to develop, but also that other contributing factors may come into play. Physical health issues like heart disease, high cholesterol, high blood pressure, diabetes, obesity, and unhealthy lifestyle can all contribute to erectile dysfunction. On the other hand, depression, anxieties, stress, relationship problems, and other mental health concerns can also interfere with sexual feelings. And this can cause or worsen your erectile problems. Often, it's a bit of both. So it's important to understand one's physical and psychological state to know the underlying cause of one's erectile dysfunction. Unlike a lot of medical conditions, the symptoms of erectile dysfunction are rather straightforward. If you have persistent trouble getting or keeping an erection, you might have erectile dysfunction. If you're dealing with any of these symptoms, a family doctor or an internist is usually a good place to start. Normally, the hardest part of diagnosing erectile dysfunction is overcoming that embarrassment and shame that comes with talking about your ED to anyone. But once you talk to your doctor or spouse, you'll find that it's common, and a diagnosis can happen quickly. For many people, a physical exam and answering some basic questions about your medical history is all that is needed. If you have a chronic health conditions or your doctor suspects an underlying condition might be involved or the cause, you could need further tests or a consultation with a specialist in the field. Millions of men are able to successfully treat their erectile dysfunction. Oral prescription medications are one popular route. Taking medications does not automatically produce an erection. These tablets amplify the effects of nitric oxide. This is a chemical that your body produces that relaxes muscles in the genitalia. Sexual stimulation releases this chemical, and these medications enhance its effect, allowing for an erection. Other less common but effective medications for ED include self-injections or urethral suppositories. If medications aren't effective, your doctor may recommend a vacuum genitalia pump. This device uses a hollow tube to create a vacuum that pulls blood into your genitalia. Penile implants are another option and involve surgically placing a device that allows the genitalia to achieve an erection. If your ED is impacting your mental health or your relationship, your doctor may also recommend that you and your partner visit a psychologist or a sexual therapist. What your treatment ultimately looks like depends on the cause and severity of your erectile dysfunction, as well as any underlying health condition that may be present. Your doctor will be able to work with you to find the right solution. Erectile dysfunction can be an uncomfortable topic to discuss with your doctor and spouse or friends, but don't assume that you're alone. Involve your partner and communicate openly and honestly about your condition. Try to remember that it's very common, and more importantly, it's very treatable. Symptoms: erectile dysfunction symptoms might include persistent trouble getting an erection, trouble keeping an erection, reduced sexual desire. A family doctor is a good place to start when you have erectile problems. It's advisable to see a doctor when you have concerns about your erections or you're experiencing other sexual problems, such as premature or delayed ejaculation. You have diabetes, heart disease, or another known health condition that might be linked to erectile dysfunction. You have other symptoms along with erectile dysfunction. Causes male sexual arousal is a complex process that involves the brain, hormones, emotions, nerves, muscles, and blood vessels. Erectile dysfunction can result from a problem with any of these. Likewise, stress and mental health concerns can cause or worsen erectile dysfunction. Sometimes a combination of physical and psychological issues causes erectile dysfunction. For instance, a minor physical condition that slows your sexual response might cause anxiety about maintaining an erection. The resulting anxiety can lead to or worsen erectile dysfunction. Some physical causes of erectile dysfunction. In some cases, erectile dysfunction is caused by something physical. Common causes include heart disease, clogged blood vessels, atherosclerosis, high cholesterol, high blood pressure, diabetes, obesity, metabolic syndrome, a condition involving increased blood pressure, high insulin levels, body fat around the waist, and high cholesterol, Parkinson's disease, multiple sclerosis, certain prescription medications, tobacco use, Peyronie's disease, development of scar tissue inside the genitalia, alcoholism and other forms of substance abuse, sleep disorders, treatments for prostate cancer or enlarged prostate, surgeries or injuries that affect the pelvic area or spinal cord, low testosterone. Some psychological causes of erectile dysfunction. The brain plays a key role in triggering the series of physical events that cause an erection, starting with feelings of sexual excitement. A number of things can interfere with sexual feelings and cause or worsen erectile dysfunction. These include depression, anxiety, or other mental health conditions, stress, relationship problems due to stress, poor communication, or other concerns. Some of the risk factors. As you get older by age, erections might take longer to develop and might not be as firm as usual. You might need more direct touch to your genitalia to get and keep a strong usual erection. Various risk factors can contribute to erectile dysfunction, including medical conditions, particularly diabetes or heart conditions. Tobacco use, which restricts blood flow to veins and arteries, can, over time, cause chronic health conditions that lead to erectile dysfunction. Being overweight, especially if you're obese. Certain medical treatments, such as prostate surgery or radiation treatment for cancer. Injuries, particularly if they damage the nerves or arteries that control erections. Medications, including antidepressants, antihistamines, and medications to treat high blood pressure, pain, or prostate conditions. Psychological conditions, such as stress, anxiety, or depression. Drug and alcohol use, especially if you're a long-term drug user or heavy drinker. Some complications. Complications resulting from erectile dysfunction can include an unsatisfactory sex life, stress or anxiety, embarrassment or low self-esteem, relationship problems, the inability to get your partner pregnant. Prevention. The best way to prevent erectile dysfunction is to make healthy lifestyle choices and to manage any existing health conditions. For example, inform your doctor and spouse on time and work with your doctor to manage diabetes, heart disease, or other chronic health conditions. See your doctor for regular checkups and medical screening test process. Stop smoking, limit or avoid alcohol, and don't use illegal drugs. Exercise regularly daily if possible. Try your possible best to take steps to reduce stress. Get help for anxiety, depression, or other mental health concerns from professionals.